I just want to address issue which we are facing very often. Yesterday I got a call from one of a junior dentist. He just started practicing recently in Bangalore. So he called and said, sir, I did a root canal for a patient. Patient was told 4,500 and they paid me 2,000 rupees advance, and I started the procedure. And the in the second appointment, the patient started developing pain, and the patient wanted to get it removed. So the patient was referred by one of that friend's friend. So the patient had an extraction done and went and told the patient, the patient went and told the one who referred that my friend is an inexperienced dentist and my friend is not doing a good job. So through the referring friend, the patient was asking for the refund of the money. They were telling, you did only extraction for which charges maybe 500 rupees. Why did you charge 2,000 rupees for the re-RCT? So dear friends, when I was asking my friend, did you inform all the pricing in advance properly to the patient? You know, my friend said, sir, I tried telling them everything, but he was not very clear of it. So I felt that my friend would not have conveyed the money matters properly. Dear friends, when during this corona time, during this present corona days, a lot of people are very emotional, especially patients are very emotional. They're very scared, they're very upset, and I am feeling nowadays acceptance of treatment is high, and also the curiosity of the patient about the sterilization, whether it is proper, whether we are doing a good job. There are so many emotional factors are coming into the patient's mind. Why I'm telling you this is because especially money matters. If you are charging something, please inform them, get it in writing, especially whether it is only for root canal or only for crown. You have to tell them and give them in writing, because some people say you are charging root canal 5,000 rupees. I thought it includes crown. There should be no thought business at all. Please don't allow the patients to say thought business. I thought like this, I thought like that. So I want to advise, whenever you are dealing with any patient, first the principle you have to follow is IPR, inform before perform. Inform before perform. So you have to first inform them before you perform. So you have to tell them, sir, this is the number of treatment, this is the treatment I'm going to give you, this is the number of times you have to come, and this is the money, and this money includes the first visit, second visit, the filling, the x-ray, whatever you are charging. Why? Because a lot of patients, they think it includes everything, right, from crown, everything. So they always create you problems to you. So why I would like to advise you friends is, in my clinic we have a treatment agreement form. We have a form where we write everything like a consent form. It is also a COVID consent form, also a form where I always tell the patient what is the treatment, when it is going to be done, who will do this, what is the charges, what are the charges includes this and excludes that. When you don't write things clearly, when you give in writing, there is no problem at all. The moment when my assistants break this rule, sometimes if they don't write it, there is always a problem if you break the rule. Problems never come if you follow the rule. So as a thumb rule, I always tell my patients what I am going to do, when I will do, what and all it is included, what and all is not included very clearly, whether it is only root canal or with crown or without crown, whether it is a packaged treatment or whether it is just a single treatment. So when you leave chance for patients to ask questions, you know, when you don't tell this clearly, never ever do any procedure without telling the patient, chalo, let's do it, and then we can tell. If they're asking for extraction price, I always tell them, if it is a simple extraction, I charge this much. But if it breaks and if it takes time, always I tell the patient, my charges are for 4 things: the procedure, the materials involved, the time involved, and the person who is doing it. There are 4 things which are there. Yesterday, one of my patient also, he came in January, we did a root canal, and when my receptionist told the patient that we will be charging a consultation fees, he started shouting. He said, I paid root canal 4,500 in January. why you are charging again now? So when the patient came inside, he said, sir, I want to get the filling done, because the patient came for root canal, he didn't come for the filling. So this also has to be written in the consent form. If the treatment is incomplete because of the patient, the acceptance of the consequences should be by the patient only. So patient, what and all you have to tell, please don't tell. You have to write everything very clearly. So yesterday my patient was telling, sir, luckily in the treatment card, my doctor has written two things very clearly. One thing is, patient don't want to go for a filling, patient don't want to go for a crown. So this has been documented by my doctor, and I told my patient, see, you don't want filling, you don't want a crown, so the temporary filling has came out and you are having pain, so you have to pay for the next course of treatments, and we cannot do anything free of cost. Since you are a old patient, I will consider your request and we will charge you reasonably. So there are a lot of problems coming with patients now, because patients are not having money. Patients don't have money flow in their hands. They are creating a lot of issues. They want refunds. Okay. The second thing I want to tell you is, a lot of people are paying advance money. In our clinic, if I am calling for a consultant, if I am calling for any procedure in advance, we always take the money in advance. We have to say if it is 5,000, we always say pay 3,000 advance, balance you can pay tomorrow. So we always insist this, because patients, with this system, the patients will not get absent, because they have paid the money. They will always, since he has paid the money, he will always come. There is no chances of any surprise. So no free appointments, paid appointments only, especially for consultant cases and for special cases. Okay. So in this also, we are very meticulous in telling the patient that they have to bring the money, the balance money tomorrow. And we always tell them, no refund policy. No, there is a policy you have to have, and you have to give it in writing. No refunds permitted, no cancellation. Or if you are cancelling the appointment for any reason, the first cancellation will be carrying 500 rupees as a cancellation charges. So if you don't do this, they will pay you the advance, they will go home and they will call and tell, I won't come, refund my money. So when you go to any company, there will be always refund policy, there will be cancellation policy, there will be always a pricing policy. If you don't have these policies in place, you will have problem. If you have all these policies, and if you inform the patient, your customer, properly that this is the pricing policy, we don't give discount, or we give discount if you do this, whatever policy you want to create. Second thing is refund policy. There is no refund, or refund means we will charge you some we will charge you some charges. So when we don't follow this, we get into trouble. Since I am doing practice management training to doctors, we follow a lot of protocols and policies which really helps in overcoming the problem. There are always problems which will come, but we have to overcome them. And in one of my native place, in one of my friend's native place, one of my friend has got into trouble with one of his patient, where patient has done orthodontic treatment from my friend, and 1 or 2 appointments that patient was missing out. So my friend was having issue with that patient, and the patient went and did give a complaint to the district collector, and the collector initiated an inquiry, and the inquiry is going on with the doctor. I'm telling you, dear friends, if we don't follow the rules and if we take emotional decisions, we will get into trouble. So please be very professional with your patients in terms of telling the pricing. Write the pricing, give them in writing, and everything you need to be very, very documented. You have to have proofs, you have to have evidence. Photographs are must, x-rays are must, and terms and conditions are must. Always tell the patient what you are going to do, what are the things you are going to do, and ask them, okay, now please can you tell what I have told you? Our patient will tell, நீங்க எப்படி சொன்னீங்க, அப்படி சொன்னீங்க, இதெல்லாம் சொன்னீங்க. So please be very, very careful in listening back and understand whether they have understood the pricing correctly, whether they have understood the inclusives and exclusives. If you don't tell the inclusives and exclusive correctly, always your patient intelligence, emotions are high, intelligence will become low. So don't allow emotional things to happen in your clinic. Rather have everything in writing, have everything in communication should be very clear. Thank you, dear friends. Thank you for watching this video. If you like this video, comment your feedback, comment your problems. We can discuss this and explain. And if you like this video, please share this video. Thank you and God bless you.